the more unnecessary visits to the ER, the more people that occupy beds in our acute care setting, in our ICU setting, that are there simply for having COVID, the less capacity we have to treat people who are in urgent need of treatment for a stroke, for a heart attack, for a car accident. And when they say they're going to have to triage care, that really means they're making an assessment about who is the most important person. And they do this on a regular basis, but I think what you heard them say in very abbreviated form that resonates with me is they're making life and death decisions when you're walking in the door about your probability of survival. And obviously they do on a daily basis provide medical treatment to save life of every person that comes in. But when the volume gets so high, you have to make a determination about where your efforts are best placed. So this is something that is very urgent. It has been explained to me by the medical professionals that this is a place that we do not want to be. But if you think about it, there is just a limited capacity to serve. There are only so many nurses and doctors and respiratory techs and all of the other associated people to care for patients. And when you run out of that capacity, you're left with very few other options. And so I think you're right to say that people who have non-COVID related injuries are being put at risk by the number of people that are being treated for the disease in the hospitals, especially when it is preventable.